Okay, so I make the time 2:02. Good afternoon and welcome to Exporting the Best of Southwest, taking healthcare and life science companies internationally webinar, brought to you by the Department for International Trade Southwest and Business West. My name is Mark and I work for the events team here at DIT. Before we start today's webinar, here are some housekeeping points. If you're having any technical difficulties, please type them into the chat function on the right-hand side of your screen and direct them to DITSW events, and I will endeavour to help. If you have any questions, please type them into the Q&A tab. We have allowed time at the end for these to be answered. We'll try our best to get through all of the questions. For those who are unable to answer, we will follow up after the event. Finally, please note this webinar will be recorded. I'm now pleased to introduce my colleague, Jamie Shaw, who's the Department for International Trade Southwest Healthcare and Life Science Sector Specialist. Over to you, Jamie.
Yes, thank you, Mark, and hello, everybody. Thank you for joining this afternoon, this webinar. It is most appreciated. I know we're all incredibly busy and spinning a number of plates, so joining this webinar is very much appreciated. Thank you. I've recently joined the Department for International Trade based in the Southwest region as a healthcare life science sector specialist. Prior to this, I was a delivery partner of the Department for International Trade. Prior to that, I was working for a very large medical device company based out of China, covering the Southeast and Asia Pacific region. This role has been created alongside several other new colleagues that have joined the business in sectors that have been strategically appointed. It's fantastic to see that healthcare life sciences as a sector is being recognised nationally, but perhaps more pertinently to my appointment within this region. So for those who are on the webinar that already have existing contacts within the Department for International Trade in the region, predominantly your international trade advisor, then please do carry on having those conversations with them. My role is essentially to act as a support mechanism. We have so many good companies in the region in this sector that perhaps aren't aware of the opportunities that are available for them to trade internationally. So my role is essentially to be having as many conversations and encouraging companies as best as possible, and of course supporting where I possibly can. And this event marks the first event, the inaugural event, in what is planned to be a larger series, which will cover various other markets and also subsectors within the sector. So in joining this event today, thank you very much. You will be contacted in the near future, should you wish to be, about the additional events that are going to be showcased. And of course, if you want to have a chat with myself, then please don't hesitate to get into touch. I decided to do the first session today in collaboration with two people that I know very well and have worked with previously: Martin Harper, who is at Aposave, and Pat Howland, who is at Teledyne ETV. Instead of talking about my opinions on export for the first session, I just wanted to bring on board two companies, obviously UK companies, that are trading and not just trading but exporting and doing a really good job of it. So I thank them both for joining today, and of course they will talk a little bit more about their businesses when we get to them. There will be a Q&A session as well at the end, so feel free to put any questions in the Q&A box, and myself or Martin and or Pat would be delighted to answer them. So for those of you who aren't aware of the DIT, the Department for International Trade, very simply, we support UK businesses to grow internationally. I think the strong point that DIT has particularly is our coverage. So we operate globally in over 100 countries, based at British embassies, consulates and high commissions overseas. And globally, we have around 2,400 staff members. Locally, here in the Southwest, I'm personally based in Bristol, but the Bristol office is merely just that, for wider support across the Southwest region. We provide professional and impartial export advice. We help businesses to create and deliver export strategies, and we connect businesses to in-market help and support. There is a lot of programs and support out there that the DIT offers. Of course, I'd be very happy to talk about these to anybody that is interested a lot of you will already know these services. The trade shows that we offer via the TAP grants, the Trade Access Programme grants, they're currently on the website if you just Google and search for these. But of course, with the uncertainty of online, offline for the foreseeable future, there isn't been announcements yet what the next financial year looks like. But for example, Medica and Arab Health are just examples of some of the support, some of the exhibitions and conferences we support. Market research, partner identification and meeting brokerage. There is a ESIF internationalisation fund that has gone live this year, which is up to £9,000 match funded for any companies that are eligible for that. So please get in touch. UK Export Finance is there to support any businesses. No export should fail through lack of finance. That's essentially what the UK Export Finance Department is there to support. Resources include myself and colleagues, the great.gov.uk website. The Export Academy is quite interesting. Perhaps Mark would be able to share that in the follow-up email after that. That's gone live this year and is essentially an online programme of sessions that are designed for businesses that turn over less than £500,000, walking them through the do's and don'ts of export. That's 9 sessions in total, and that's really, really good. So Mark, if you could kindly point that out as well. Brexit, of course, new rules are here. The gov.uk website, has a transition page. But of course, you're very welcome to get in touch with us as well, should you have naturally bespoke and individual questions that perhaps aren't being realised from looking online. The DIT in this sector works closely with other government organisations, including but not limited to Healthcare UK and the Office for Life Sciences. Again, I think a strength of DIT. We identify the biggest healthcare opportunities, engage the UK healthcare sector in maximising export potential, promoting the UK healthcare sector internationally, and helping to convert opportunities into export successes. Broadly speaking, and again, I think this is one of the reasons why the role has been created and why I've been brought on board, is that government recognises the healthcare life sciences sector of one of paramount importance moving forward. It contributes 11.4% of all manufactured goods exported from the UK. Of course, there is a strong reputation. The UK has a strong global reputation. There is a high demand overseas to work with UK exporters that bring expertise, experience and innovative solutions. The global market is expanding, anticipated to be around 5% each year up until 2023. And in the Southwest, finally, companies of all shapes and sizes may not realise that they indeed either have an opportunity to export or indeed expand their export significantly. It's not just an exclusive club of large UK-based multinational companies. We work with businesses of all shapes and sizes, so please don't hesitate to get in touch should you want to have a conversation. So it's at that point I would like to introduce our first speaker, who is Pat Howland, and Pat works for Teledyne ETV, been there for a long time, Pat. But I'll let you explain a little bit more. And again, to everyone that's joined today, thank you very much. So Pat, I will pass over to you. Thank you.
Hi, Jamie. Thank you. Hang on, technical problem. Sorry, moving on my, sorry, Martin, moving on my slides. Obviously, fell at the first hurdle here. Sorry. Okay. Sorry. So I'm Pat Howland. I work for Teledyne ETV. Perfect. I work for Teledyne ETV, and I do apologise for not having, not getting to grips with the moving on slides. Teledyne ETV has been around for a long time. We were founded in 1947 and were part of the Marconi Empire many years ago. We're based in Chelmsford in Essex, and we specialise very much in vacuum devices and systems. We're really all about generating high energy microwaves. And in the UK, there's 550 employees. We've got 7 locations around the world. The design, development and manufacture of pretty much all of our products is done in the UK. We do have a small assembly area in a facility in Beijing, which was set up about 8 to 10 years ago. And then around the rest of the world, we have sales offices and also work through distributors. Core part of our business is very much working with customers. We've developed long-term and very close relationships with our customers. And key part of how we grow our business is to work with those customers from the initial system concept, design, manufacture and integration to become designed into their new platforms. Our products are, as I said, it's about high energy microwaves, and these can be used across many, many different market sectors. And selection of these are healthcare. So we produce some of the core components and subsystems that go into radiotherapy systems for cancer treatment. These really produce the microwaves, which are part of the linear accelerator. They produce the X-rays, which then go on to be targeted at tumours to destroy the cancers. Similarly, we make products going into lithotripsy for smashing and destruction of kidney stones. Same type of products are used in cargo scanning. So this is producing high energy X-rays to look at things like counterfeits, explosives, and weapons and other things in cargo on ships and in trucks crossing borders. Also, the similar type of products go into non-destructive testing, looking for issues maybe in welding, in pipes, in the nuclear industry. We also have a very strong market in marine radar and airborne radar, looking at navigation, traffic, collision avoidance, and again, also similar type of products going into high energy physics into some of the key laboratories around the world, like CERN and Stanford Laboratory in California. We've also got a strong presence still in defence and security, electronic warfare and radar applications. The biggest part of our business is very much the radiotherapy side of the business, where we export a large amount of our products. We are actually, the main products which go into these systems are magnetrons and thyrotrons. They're the key components, and then also the development of subsystems. So this is one of our key growth areas in the healthcare sector. So our customers for these products are some of the, the well-established customers such as Varian and Electa, who have a very strong market presence around the world. And these are some of the very well-established customers. And then also newer customers such as ViewRay and Reflection, who are developing more novel-based systems for radiotherapy, particularly in sort of America. We also work with a lot of newer companies in China, companies such as United Imaging, which is developing a new system. And again, we are designed into their radiotherapy platform. Move on, I think, a couple of slides, if that's okay. So, as I said, we're well established in the radiotherapy market. Our products can be found in about 90% of the radiotherapy systems around the world. It's a strong export market for us, and the export goes through different routes. It's either through the manufacturers of radiotherapy systems who sell globally to hospitals, and also in the spares market for hospitals, it's through the service of those systems and through distributors. As you can see from the map that's up here now, there's a vast difference in the density of radiotherapy systems around the globe. So in Europe and Australasia, North America and parts of Central America, there's a lot of radiotherapy systems and there's plenty for everyone to get their cancer treatment. But in other areas such as China, India, Africa, and parts of Central and South America, there's a huge unmet need. And these are the markets which for radiotherapy will be growing in the future. And these are where we're really trying to establish what we should be doing in those areas to support both our customers and to get a good presence in those markets and make sure that we've got the right strategy in those territories to grow as the markets are growing. So I just want to talk to you about one example of where we've worked closely with DIT, the British Embassy, and the China-Britain Business Council. And that's in China. So many years ago, we used to sell all of our products into China through a distributor. We were based in the UK and the distributor obviously based in China, supporting hospitals and some of the domestic radiotherapy companies out in China. We used to visit maybe a couple of times a year, taking a technical team, a commercial team, and customer support, and going around to those customers and, talking about any problems they may have technically, getting into the future design of new platforms, and also dealing with any commercial discussions. That was fine, but we did feel that we were quite remote from that market and really didn't understand completely what was going on within that market. So several years ago now, the government in China, understanding that there was an unmet need, has really funded the development of new radiotherapy systems with manufacturers in China, and also funding radiotherapy systems to go into hospitals. At that stage, two of our main customers, Varian and Elekta, set up facilities in Beijing. And at that time, we felt that it might be the right thing for us to do to look at having a facility in Beijing. So we did. We set one up about 8 to 10 years ago. And that was very much focused around having applications engineering support who could work closely with the customers, also customer service and training facilities for hospitals, again, to provide support to the hospitals who use our products. And more recently out there, we've been working with our procurement teams to set up a local supply chain. We've more recently set up an assembly within China as well, and taking advantage of being close to our key customers out there. We've found that making that transition from working through a distributor and just travelling and visiting a couple of times a year has had a huge impact on our success in China. We've developed much closer relationships with all of the manufacturers out there and have a much better understanding of the hospitals and how we can support them. More recently out there, we were looking to see, through the success that we were having, whether we should expand our facilities. And this is where I really got involved with DIT, the British Embassy, and the China-Britain Business Council, who work in partnership with DIT. We wanted to expand our facilities, but obviously that comes with cost and potential risk if you get it wrong. So working with DIT and the China-Britain Business Council, they set up meetings for us, made introductions for us to understand more about the procurement, how quickly the market was going to grow out there, what were the best routes for us to be well positioned in that market to take advantage of the growth, and also look at where we should be located as, the next period of expansion for us needed to be suitable for 5 or 10 years. Do we stay around Beijing, near to our customers, or should we be looking at one of the free trade zones, maybe close to Beijing or Shanghai? So it was through working with DIT, China-Britain Business Council, that we, a couple of years ago and last year, set up a number of meetings, gave us the opportunity to speak to people involved in hospitals, free trade zones, regulatory, organisations to really understand the best route for us and to help us develop our strategy. And so recently, within the last year, we've now expanded the facilities at our current location. We felt at the moment this was the right thing to do, and we're now sort of looking on the next part of our journey in China and helping to grow there. So finally, where I've been working with the Department of International Trade is looking at some of those other overseas sectors. As I said, in India, South America, and those other areas where we want to grow and have a presence or a stronger presence in those areas, but also determine what our growth strategy should be in those areas as those radiotherapy markets expand. So the majority of the work that I've been doing with DIT and the great assistance that I've had from them has been in two different areas. One of these is through the overseas market research reports that they will undertake. I've had a number of those done in APAC, in South America, even in Europe and Australia. And really, I've asked them to look at some real bespoke market research for me. So I've worked out exactly what it is I want to know, and then I've sent that through to the Department of International Trade. They've then put me in contact with the various offices in the different countries, and then I've worked with those people in those countries to answer the questions that I've wanted. And I must say the quality of what I've had back has been really useful. In some areas we're going further, and in others we're maybe waiting, and we'll look at those at a later time. India is one area where I've had more in-depth discussions and support from DIT. India, we believe, is going to be, the next key growth area after China. And so we've had questions as to whether we whether we follow the kind of the route and the business model that we've got in China. Is that the right thing to do? Or do we just carry on working out there with either a sales office or a distributor? Lots of unanswered questions. So again, working with DIT and this time the UK India Business Council, we've carried out a lot of research into the market, again, understanding the hospitals, the procurement routes, the regulatory landscape, competition, and also what our potential routes to market could be. So we initially did some market research, and then more recently, last year and through into the early part of this year, DIT have been very supportive in opening up contacts for me, making arrangements for meetings with different organisations in India, and then supporting those meetings and the work with me. So they haven't just set up the meeting and said, okay, Pat, off you go, that's yours. We've really worked out how they can support both through the meetings and afterwards. And so, again, in India, we've had a lot of detailed work now looking at our strategy for India, and then also, in other areas as well. So I would say that although we're a company that is well established in the market, we do a lot of export. Majority of our products are exported. We really have used DIT and got real benefit from using those in looking at our strategies to grow this business further. And I personally would recommend that to anybody, and really delighted with the support and the work that we've had with the Department of International Trade. So thank you very much.
Pat, hi, thank you very much for that, most appreciated. I'm going to, Francis, thank you for your question. We'll answer those questions at the end of the session, if that's okay. So next we've got Martin Harper from Aposave. So Martin, over to yourself.
Thank you, Jamie, and thanks, Pat, for the presentation. A bit about Abbvie, as Pat's given a bit of overview of Teledyne. I'll give you a few slides about Abbvie, and then we'll talk about how we've worked with DIT and other partner organisations to support us on our journey for exporting. So Abbvie Limited, we're a bit of a multinational company. The element I represent, which is the commercial and business development team, we're all based in the UK, so we're a UK business, and Abbvie Limited is a UK business. But we do have strong links into other parts of the world, and we haven't been around as long as Pat's organisation. We started over originally in Denmark in 2004. We then expanded into other European countries throughout the early teens, and more latterly over into Hong Kong. And this year, 2021, we're heading into China and the US. So we're a bit of a multinational business with a UK focus. As you can see, one of our head offices in Copenhagen in Denmark, where the original business started. Our operational hub for the Abbvie business is in the Netherlands. And then, as I said before, the commercial and the business development teams are situated in Farnborough in the UK, just outside London. We're part of a much larger business, which is the Abacus Medicine Group, that again has offices all over the world. In total, it's about 1,000 plus employees. We distribute medicines, that's our business, so medicines, well in excess of 800,000 to 1 million units globally. We do have a global reach. We have our own marketing authorizations or licenses, because we reproduce medicines and distribute those purely within the EU. We have 200 active and quality assured approved suppliers where we access our medicines. And revenues at the end of 2019 were in excess of 650 million euros, with our goal to achieve 1 billion euro turnover in the next 3 years. In terms of what we do, we operate in the healthcare market, and we're again different to Teledyne in the fact that we don't actually make any products ourselves. What we're about is accessing medicines from all across the world, any part of the world, and moving them around the world to where they're most required. There's a couple of major factors at play in the healthcare market that have impacted globally. There's a huge increase in the cost of healthcare in all parts of the world. There's declining return on investment in pharma research and development. So a lot of pharmacos are looking how they can access revenue streams earlier in the development of medicines or look to acquire other businesses. And then more importantly, and most importantly, there is a need for patients, wherever they might be in the world, to access new drugs. Now, this isn't just a phenomenon where you might think, oh, if I go to developing parts of the world, it's harder to access medicines. Even in the main European countries, there's a huge variation on how many people can access medicines, because not all medicines are marketed and launched in every geography in the world. We have a vast amount of industry experience. Up on the slide is a number of very well-known global pharmaceutical manufacturers. Other ones from other parts of the world. Pat mentioned China. We also operate in Asia Pacific, and we do quite a lot of work over there with Chinese pharmaceutical manufacturers, which I'll touch on later on as well. The industry experience we have also is based on the team of people that work at Abbvie. A lot of us have been around the industry for a long time, and we have quite an unrivaled network of people we can draw on across these organisations and other organisations to help us with our business. What we try and do at Abbvie, it's like a sort of consultative approach when we meet with clients. Our clients are threefold, really. We deal with the pharmaceutical manufacturers. We deal with the healthcare professionals, the doctors, hospitals, clinics who use the medicines. And we also have an indirect relationship with the patients, because via the healthcare professionals we support, we obviously help the patients access the medicines. What we bring to the party is a pretty straightforward approach, really. We utilise the expertise and knowledge that we have across our business and the know-how to understand what is required by our customers and clients. We try and be flexible and agile. We're a relatively small organisation, which gives us the advantage of being fleet of foot. And that agility and flexibility allows us to think about how we might want to provide solutions for our partners. The solutions we do provide are always service-oriented. So we don't say, this is what we offer, you can have this, this or this. We engage our clients, speak to them, understand what they want, and hopefully provide a solution that fits those requirements. And again, what we're looking for primarily, all the time, ideally in our transactions, in our work we do, is we're looking to build long-term strategic partnerships that add value to all the stakeholders, ourselves, our clients, and the patients. We're not too interested in transactional partnerships, although we have to do them, we will do. But it's mainly a strategic partnership focus that we'd like to adhere to. Here's a number of the service offerings that we operate across. I won't go through all the points, you'll be glad to hear. But we operate in 4 really distinct areas. Clinical trial solutions. So before a medicine is licensed, we can work with pharmaceutical manufacturers to help develop those services, those new drugs. Things that might be required for a clinical trial solution will be comparative products. So there's a huge surge in clinical trials, and a lot of them in areas such as China, India, are big markets where there's a lot of clinical trials happening. Those trials will need comparative products to help with those trials. And a lot of those comparative products, or the original products, will be owned by EU or based in the EU or US. We'll access those products and then we'll move them around the world and export them out to the markets that need them. Also in the unlicensed area, we run things called managed access programs. So if a product is licensed anywhere in the world, it can be provided to patients through a managed access program. And we design and run programs on behalf of pharmaceutical manufacturers to allow their medicines to be accessed in different parts of the world where they might not at the present have a marketing authorization. We also do unlicensed medicines. This is driven by the healthcare professional who will be approached by patients. They'll be aware, obviously, of the medicines that are being developed in the specialist therapeutic area they work in. And also patients are much more aware and empowered on the knowledge of new products, that come to market. So if a patient goes into a doctor's clinic in Hong Kong and says, I've seen a new oncology medicine that's available in the US, I'd like to try that, please. Then that doctor can reach out to us in Hong Kong. We will look to source the medicine for the US market and bring that across so the patient can access it. Finally, we do commercial partnerships. This is where we work mainly across our pan-European base, and we offer a various number of solutions to partners in terms of we might repackage products, move them around the EU member states, and also provide other services such as data and sales support and key opinion leader management with healthcare professionals. Obviously, I'm well aware that due to Brexit, we're not part of the EU in the UK anymore. But as I said earlier in my presentation, we have other offices in the EU, and our operational hub is based in the Netherlands, which allows us to do that still in an effective way. In terms of some specifics that we've encountered in terms of our export journey now, prior to 2019, even though we were working in Europe, our history of exporting was extremely limited. A new management team arrived in the business only in 2018-19 when the UK office was opened up. Excuse me. And that management team was obviously looking at business development and commercial growth. We did a few sort of medicines from the UK to Hong Kong to satisfy wealthy Chinese health tourism, but generally that was it. When we arrived in 2018-19 as the new management team, we had a look and we started reviewing what our potential client base was, and we started allocating dedicated business development resource to explore those opportunities, whereas before it had been a little bit piecemeal. If a opportunity arose, we chase after it and deal with it. But with the new management team, we followed a much more structured approach on what we wanted to do. We did a large amount of market analysis to try and understand which markets we should operate in and which markets we should maybe put on the back burner, because we couldn't attack all the markets we wanted to at the same time due to constraints on resource and time, basically. At that same time, I was introduced to my local Department of International Trade. and they proved very useful. So I work with Jamie obviously in the southwest, but also Dermot Sheehan in the southeast as well. And to be honest with you, when I started, I'm not quite sure what these guys bring to the table. I didn't know anything about the Department of International Trade. But what I found was it was an incredibly useful way of helping me shape my plan and my strategy for how I was going to approach exports. And most importantly, it meant that I didn't feel I was on my own. Okay, I was working with my management team and my colleagues at the business, but I had a third party or third parties to help me process the information and make the decisions and move forward on my journey. What that meant was, and how did the department and the DIT help us, was really straightforward, a number of areas. We had some introductory meetings, representatives to understand our business, so they took the time to understand what we did and also introduced us to third-party or partner organisations, people such as the China-Britain Business Council, who perhaps already mentioned, who proved extremely useful in terms of, again, helping us penetrate certain markets, China obviously in this situation. We also, through that network of clients, either through the Department of International Trade or through their partner organisations such as the CBBC, we got introduced to other businesses. Now, they weren't necessarily in the same genre of business that I'm in, but they were in the health and life sciences sector. And from that, we could share experiences. So I've spoken to a number of businesses who've been more than happy to help me discuss their journeys on exports, discuss their journeys on looking to set up new businesses or recruit people in different markets to aid my export business. And it's been a wonderful, unexpected support network that's proved really, really useful. On a more sort of material, tangible basis, the department does provide some really interesting grants and facilitates those for trade shows and congresses. Jamie mentioned Arab Health. We attended that last year, just before the first lockdown, and we were eligible for grants from the department in terms of our hotel accommodation and our flights out there. And it's really helpful if you're a smaller business as we are, and you're just starting out in your journey, and you want to invest your money wisely. Any additional support financially that we can be given, and it allows you to confidently say, okay, yes, I think we can go to this conference and invest in it now. Gives that little bit of additional support, and that's really useful to get you out there and start seeing the clients and understanding those markets much more. As I said before, it's a real mine of information with all the different aspects we've talked about. I've spent a lot of time on webinars at the start of last year with the department, with partners, with private companies, with individuals, as I was formulating my strategy to enter into the Chinese market. And that's worked really well because I'm pleased to say this year we're in the process now of working with the CBBC, and we've just posted an advert for our first business development executive to work and be based in China out of Shanghai. And all the support we got from the various parties was really, really useful in helping us get to the right decision we wanted to make, and then also to go ahead and facilitate the delivery of that decision. What does it mean for us now in terms of exports now and in the future? I think the big thing that the DIT has done is it's really increased our confidence and our knowledge. And with that knowledge, the confidence has grown. It's led us to further invest in the business development resource, as I mentioned. We're putting e-resource into China. We might not have done that if we hadn't had as a successful introduction to China and realised some good export opportunities there. It's also uncovered new territories and new product areas for us. So we've uncovered a number of really interesting parties in South America, Latin America, who we're dealing with. And also recently, Pat again mentioned India. We've just done our first large export deals just before Christmas with a large Indian company. And we're confident that we're doing many more this year already. In the first few days back into the new year, we've had some really positive discussions with them, and we've got a number of other large deals in the pipeline lined up to move product out to India. It's also helped us declutter, as I mentioned before. It's helped us identify geographies where actually we'll probably deprioritise. we have a finite amount of resource, we have a finite amount of financial resources, and a finite amount of energy to attack these markets. So it's really helped us focus in on where we should and shouldn't play. And finally, the best part is that, as a result of all the work we've done, our revenues have increased and these new markets have opened up. So in all, it's been a really positive experience. And we're really at the start of our journey. So as Pat is from a much more developed and established business, it goes to show that whichever stage of the journey your business is at in its development, the department and its partners can really help you shape your strategy. And I think that's it for me. Thank you very much.
Martin, thank you so much for that presentation, and of course, Pat as well. Thank you very much indeed. I can see that Francis has asked the question about the Gold Key service offered by the US Department of Commerce. I did have to Google it, Francis, so I'm glad I wasn't asked that off the cuff. But essentially, yes, we do have a very similar service. So that's called the OMIS service, which is the Overseas Market Introductory Service. Essentially, that would need to be a tailored conversation, of course, because it would depend on where you're looking to identify and open up new channels. That would typically be delivered by our partners overseas as well, by the DIT network. That is, of course, a chargeable service. However, it is discounted, and the scope of it can be as large or as small or as ambitious as you want it to be. So it very much depends on how many prospective partners or distributors or end users, you name it, you want to reach out to. So yes, let's have a conversation after the event. I can drop you an email and we can have a chat. But thank you for your questions. If anybody does have any questions that they just want to drop in into the chat box, please feel free to do so. I just wanted to ask Martin and Pat respectively a kind of quite a simple question, but one that often a lot of companies are interested to know is essentially what do you know now that you wished you would perhaps have known at the start of your journey? So Pat, would you be kind enough to answer that first, please? Oh, sorry, Pat. I think you're on mute.
Sorry about that. I think probably if I take China as one of the examples, it really is knowing. It would have been knowing that the DIT and China Britain Business Council were there several years ago, and that all of the things that were available to us and all of the support that we've had, I've known about because. Sitting at your desk in the UK and maybe just travelling out there once a year, working with a distributor, there was a lot that we didn't know and needed to understand. And it's quite difficult doing some of that from the UK. Distributor that we had was very good, but there was that real remoteness. So I think sort of trying to get access to regulatory people, to the hospitals, to the procurement, and that side of it, and really understanding the market and what we should be doing, where we should be developing. I think the support that I've had from DIT is one of the key things that it would have been great to have known many years ago before I really got involved with you guys. So I think that's my simple answer.
I think, Jamie, you're asking me to answer. I'm getting to you. To answer your question, to build on what Pat said, yeah, I think we were more fortunate in relation to Pat's business, so we're much earlier on in the cycle, and we were fortunate. We did admittedly probably stumble across the DIT in terms of getting an introduction, but once we got the introduction, it was really useful that as Pat says, when you're sitting behind your desk in the UK and you can feel quite detached, and even if you can get out to the market you want to assess, that can help to a certain extent, but you don't know what you don't know. So to have someone, to know you're not on your own, to have someone there who can then introduce you to other subject matter experts like China Britain Business Council, who admittedly I'd never heard of before I'd had a discussion with the DIT, didn't know they existed, was really helpful in terms of how we then formulated our strategy. I think it was helpful then that it made us think about the strategy and think about how we'd approach the Chinese market and the wider Asia Pacific market. So that was useful in terms of that, and also then introducing us to other private consultancy firms that then help us even further, who then, we pay to use their services, but then we would work out a few more details and a few of the nuances. We don't have the resource and the size of team to investigate every regulation, every aspect, every tax implication of what we need to do. So to have partners who could help was really good. And what we found was a lot of these partners would give you almost like free advice. They'd talk to you and consult with you and support you, which was really, really helpful. I think just to balance that answer out, though, the other side is that there can be a situation sometimes when you think about should I export, should I do this, that it's probably too easy to say, oh, I'm not sure because there might be some risks involved. Should I try it? I think my advice would be, we probably did that a little bit to start with. My advice would be, obviously manage your risks, but don't be afraid to have a go and try these things, because you do actually learn an awful lot from actually doing the export and understanding and trying to do the business with the market as well.
Martin, thank you for that. And of course, Pat, thank you as well. One of the questions that we've had come through is around, let me just have a look here. Yeah, I mean, I don't know if you're in a sort of a position to share this, but the sort of the costs associated with market research pieces that you've had done previously. I don't know if that's alluding to OMIS or anything like that. I don't know if either of you can share that kind of information on this call.
Oh. Sorry, yes. For some of the overseas market research that DIT have done for me, or the foreign offices have done, they've been around sort of 2.5 to 3K maybe. And what I've tended to do is maybe start with, phase the research that I've asked for. So you can then sort of take it in stages. So you start maybe with a higher level understanding of the market. And then what I've done is areas that I'm really interested in focusing down on, then go back and, sort of set out the next level of research that you would like to understand. So for some of the areas, we started maybe with a top level understanding, and then things that were of real interest to us and things that I felt I needed to know more about, then we went back into those areas. So in that way, you can actually, plan more about your spend and the costs. Make sure that it doesn't run away with you, because that obviously can be quite easy. But also it enables you to get some work done, step back, and maybe have a discussion with your trade advisor from the DIT or with the foreign office who've been doing some work for you, and really have a chat with them and determine with them and their in-country expertise and also market sector expertise to understand where you want to go next. So yeah, I've kind of taken it in different stages, but sometimes starting with that higher level and then drilling down further.
I'd echo that as well, Jamie. What Pat said, it's very much like that. I think we started with a high-level market research of a country. Again, I think the cost was a couple of £1,000 from memory. It wasn't a huge amount. We then went into this iterative process, and where we wanted to drill down into greater detail, then we would spend a little bit more money on a follow-up report which drilled down to specifics we wanted to look at. So we were looking at trying to find, for example, partners that we could work with. So we didn't have any partners in the market we were looking at. We wanted to be introduced to partners as well. So as well as doing market research and research, the partner organisation introduced us to companies who we then had really positive meetings with. As Pat said previously, you weren't just introduced and left to your own devices. The partner was there to support you as well in those discussions. And I think having the sort of gravitas, if that's the right word, in terms of the support of the DIT or the partner organisations such as CBBC in the meetings does help the potential people you're speaking to and how they engage with you. I think then at some point where we're going to make larger investments, such as investing in business development resource in country, or whether we're going to open an office in a different country, then again, I think it's a simple balance, and it's different for every business. But you look at the return on the investment. It's worth investing a few £1,000s rather than just leaping into a territory and blindly hoping it's going to work, because you can also lose an awful lot of money very quickly if you're not too careful. So each business has to make its own decision, but the iterative approach is definitely the right way to go and take it in increments.
Thank you, both of you. And I think it goes without saying as well that, of course, there's CBBC is the delivery partner within the Chinese market, and DIT works with a number of equivalent partners across various markets and territories. So should the market of interest not necessarily be, China or India, which is being mentioned, where the UK-India Business Council works closely with DIT. There's partner organisations all around the globe. So I think feel free to get in touch and we can discuss this a little bit further. We've had another question that's come through. Broadly speaking, it's asking the question of whether or not anybody has had any success within the Latin American region, taking advantage of the common market there. Pat, Martin, I don't know if you've done much sales in South America, Latin America. But for the person that's asked the question, my apologies, I can't see who it is that asked it. But on the 16th of next month, I believe, I'm going to be running an event actually on the Colombian healthcare market. So we can also be in touch with that. I know you're talking about the common market, but we will be doing a session specifically on the Colombia market. So please do keep an eye out for that. So Martin, Pat, if you've got any experience of this, that would be interesting.
Yeah, sure. I mean, we've got limited experience. We have exported and made sales to Latin America, Mexico, Colombia, Chile, Argentina. Ours are quite focused. What we're looking for is Latin America countries where we can see pharmaceutical manufacturers who are working in specific areas that we believe we can support with our services. So I'll give you an example. Biosimilars type of drug that are being developed all around the world. They're beginning to get traction in Latin America. So we focus very much in terms of where were these companies based. Mainly they were Argentina to start with, and Mexico. Through our own research and a bit of sort of support from the DIT, we also saw that the Colombian government was trying to attract that type of business to its market. So there was a investment and support from the government for biosimilar companies to set up in Colombia, which again piqued our interest. And we lined up some conferences to go to. Unfortunately, that was overtaken by the global pandemic situation that we've all been victims of last year. So we're hoping, with big fingers crossed, that we can get out and actually meet some of those. We're fortunate as well that we do have a number of offices around the world anyway. We have a number of Spanish and Portuguese speaking colleagues from different business units. So we've been able to research and engage with clients in their native language as well, which has helped. But yes, we've had limited experience of that market.
Same as Martin, we've had sort of more limited experience of Central and Latin America. we've recently started working with a company in Brazil who is a service company that goes into the various hospitals and provides service to the radiotherapy systems as well as providing parts. So we've only recently started working with them, and they, from what I've seen so far, have a really great understanding and knowledge of that market. And with us are also learning about some of the sort of more Central American countries as well. So I'd say for us it is still quite early, but we are learning about that market and what we need to do out there to support the hospitals and to help grow our business out there.
Pat, thank you. Martin, thank you. I believe that is all the questions that we've so far received. I think, as I mentioned, I can't see all of the questions. So if they haven't been answered to your satisfaction, then please feel free to get in touch with us. I'd like to, of course, thank you all for joining today. I don't think anything else has come through. Finishing slightly early. All of the slides will be shared. Of course, this will be recorded, and I'd like to thank you all again for taking part today. And have a good rest of your afternoon. And we hope to speak with you all soon. So thank you very much.
Thank you.